Good to have you on the show, Live Knowledge by Omobola Stephen. I'm the host, Omobola Stephen. We offer mind-shift conversations on topics and subjects that are related to personal development and self-improvement, offering insightful information from profound and experts who are adept in these topics, sharing disruptive yet constructive mind-shift conversations that is going to pivot the positive changes you and I need. Now, we emphasize the importance of embracing personal development and self-improvement on this show because we have come to realize the importance of doing so. When we focus on intentionally improving on ourselves, we get to find ourselves along the way. Now, it's such a beauty and a sense of fulfillment when you realize who you are, you find yourself. Life becomes so much more meaningful, and you can't even want to think of the bounties that life always has in store for you when you don't give up in improving yourself. Now, this is the mission and the focus of the podcast Live Well Lead by Omobola Stephen, where we offer mindship conversations. Today, I want to appreciate our Dr. Tonie Reincke, an interventional radiologist that evaluates and treats leg vein disease. Happy to have you on the show and looking forward to a worthwhile time.
Thank you. Thank you for having me.
Absolutely. Thank you, Dr. Tonie, for coming to the show and sharing this valuable contribution to the topic of discussion. And we want to talk about vein disease, but really, why do we need to get educated on this important subject?
Well, I think it's really important just to recognize and to be educated about it because so many people, first and foremost, don't even know that it exists. So my goal is to do outreach and education just to bring to the forefront that there is this disease that exists and that it's treatable. So there's no need for people to suffer with potential symptoms that they might have once we educate them and elucidate that it exists and that there are treatment options for it.
Oh, absolutely. We talk about a vein disease commonly misdiagnosed, or let's say undiagnosed. Can you talk a bit on that?
What I have found, I've been practicing for 10 years. I've probably treated over 10,000 patients on a daily basis, not 10,000 in a day, but over the course of 10 years. What I have found is patients will oftentimes maybe be seen by another physician, and then the changes that are seen perhaps on their skin or the symptoms that they're feeling are diagnosed as something else. Maybe they then get seen by a skin doctor, a dermatologist, or the primary care physician gives them ointments, or maybe even dismisses that it's an issue related to veins. So sometimes patients for many years will go along thinking, oh, this is just a nerve issue or something else because they're misdiagnosed. And oftentimes, actually, because of training programs, not really focusing, even my medical school really barely touched on vein disease. So the education isn't there for physicians. And so they're not even thinking about vein issues as well. So unfortunately, patients go sometimes many years without even being diagnosed with a vein issue.
Okay, right. Let's talk about the risk factors and also the procedures that can be done.
Okay, so risk factors for patient, the number one risk factor is genetic. So it's very hereditary, the predisposition for vein disease. If one of your parents has vein disease, you have about a 50% chance of getting vein disease. If both of your parents have vein disease, it now goes all the way up to a 90% chance. So the number one risk factor, again, is genetics. And then if you're predisposed to having vein disease and you add on other risk factors, such as an occupation where you sit or stand a lot during the daytime, something such as nursing or teachers or factory workers where they're standing all day long, That's an additional risk factor. Women are hormones, so estrogen and progesterone will also cause stretching of veins, which is what vein disease is. It's stretched out veins. So the genetics, estrogen, progesterone, pregnancies, when a woman becomes pregnant, her uterus, the gravid uterus, the weight of the baby will also cause some backward pressure. That's another risk factor, as well as obesity in men and women is also a contributing factor.
Thank you, Dr. Tonie, for sharing that with the audience. Really.
Sure.
So we look at the basics of vein disease. Now, do we recognize them? Maybe there's some folks out there who do not have an idea of what vein disease looks like.
That's correct. Okay. So symptomatically, things like tired, heavy, aching legs, swelling, especially these symptoms at the end of the day, visible bulging or ropey veins. And then as the disease progresses, it's a slow disease that progresses usually over the course of years. Patients will start to get oftentimes some skin discoloration. For light-skinned people, it might be a pink discoloration that starts at their ankles and kind of works their way up towards their knees. For somebody more darker skin like myself, it might be a more brownish discoloration that happens because when the veins are stretched out, the blood's going backwards, it's going towards their feet instead of towards their heart. And as they sit or stand all day, that pressure that's caused by the backward blood flow is now going to be maximum kind of at their ankles. So at the end of the day, usually the symptoms are worse. In addition to symptoms, they may see signs or changes on their skin. So they might see bulgy or ropey veins. Those veins might be tender or itch, and they may see some skin discoloration. For instance, it could be pink, like almost like it's inflamed from their ankles, starts at their ankles and slowly over years will work its way up kind of towards their knees, or it may be a brownish discoloration. Ultimately, if the vein disease is not treated, it can lead to open wounds or bleeding veins in the future. Hence the importance of recognizing that there is an issue that can be treated and then seeking out treatment from a specialist who treats vein disease.
But really, one of the core question on the mind of the audience is, why do you think that vein disease should be a part of one's overall health and wellness?
Why should it be? I think because left untreated, it can affect so many other aspects of your health. So once you realize that there is an issue, that it can be treated, it's a minimally invasive procedure, you are back to your normal activities the same day, then taking care of your health and prioritizing your health should be the goal for patients. Not treating your leg vein disease can lead to other complications, not just in your legs, of course, but imagine that you don't treat them, you have difficulty walking, performing your activities of daily living, say for instance, cooking, cleaning, providing care for your children because you can't stand for long periods of time or your legs are too swollen, etc. So prioritizing that health and then realizing that, for instance, not treating your veins, once they're treated, you can provide, it improves your circulation, maybe by 10 to 25%. You can see an improvement in circulation of blood back to the heart. Another thing, not just physical health, but mental health. Oftentimes we'll get patients in that talk about depression and anxiety related to maybe how their legs feel or how they look. And although the medical procedures are not performed based on how a patient's legs cosmetically look, imagine for a patient if they had really bad skin discoloration or open wounds, how that can affect their mental health. So I think, you know, those are important reasons to prioritize getting treated.
Okay, so who are the right personnel we need to visit when we get to the clinic?
Well, I would say always start with your primary care physician. Talking patient would seek out for a physician in their specialty training and education. What I would say is look for somebody that has specialty training in vascular or catheter-based procedures on veins. And that's what I did. I did 5-year residency and then a 1-year fellowship that specialized in treating patients with vein disease and vascular issues. Here, I recently did a lecture on what patients can look for. So seeking out a physician that's specialty trained, either interventional radiology, vascular surgery, or general surgery is a good start. Also, check their board certification. Here in Texas, you can go on the Texas Medical Board, put in a physician's name, and that will bring up what their board certification is. So I would recommend going to, like I said, one of those specialists, either IR, interventional radiology, vascular surgery, or general surgery. And by going to the website, you're able to see what their specialty is in.
And now, doctor, when is the appropriate time to check in with this medical personnel? When do you think is the appropriate time?
I think sooner than later, even if it's just for education. So if you are starting to have, say, visible bulging veins and you have symptoms, especially symptoms like swelling that gets worse at the end of the day, your legs feel really heavy towards the end of the day. It's okay when you wake up, but it's worse towards the end of the day. There's no harm in going to go speak to a specialist to gain more information. It doesn't mean that you have to be treated then, but at least getting an idea, yes or no. Yes, I think you may have vein disease, or no, you're not a good candidate, either at this time or ever. Maybe it's something else. So certainly not every patient that has tired, heavy, aching legs and swelling is that it's necessarily a vein issue. There are other things that can cause those symptoms. But I say nip it in the bud, go and see somebody sooner than later.
Right, absolutely. So is there a way this disease can be reversed?
No, it's a great question, actually. I think that's something that I emphasize with patients. These treatments are treatments. There's no cure for vein disease. So it's not like it's one and done. You get treated and then you never have to be treated. A really important point that I focus on with patients is that despite the fact that you're treated now, other veins may get stretched out in the future, have backward blood flow, and cause symptoms. And at that point, you might need other procedures.
Oh, right. So what do you think is the role of lifestyle in the prevention and also management of this disease?
I didn't hear that first part. What is
Yeah.
the goal?
What is the role of lifestyle in the prevention and management of vein disease?
Okay. The biggest thing that we try to get our patients, we want to be on board, have a collaborative relationship with patients. So the biggest thing that I do in terms of education and teaching is talking about their role, not just mine, right? So we work together as a team. And it's important for them to, if nothing else, in terms of exercise, trying to get on some kind of a schedule with dedicated walking. I would say overall, that's probably the best thing that they can do. 30 minutes a couple of times a week, if possible, is the best thing that they could do. Moving, contracting their muscles, getting the blood going in the right direction. It's good for both vein health and mental health. So that's the biggest thing. Dietary, decreasing salt intake, kind of healthy and non-processed foods, weight management. When I say weight management, it's not easy to be thin necessarily, but being thin doesn't necessarily mean that you're healthy either. So I would just say a healthy weight and drinking plenty of water, kind of minimizing other beverages or whatever that would be, soda, alcohol, etc., and really trying to stay hydrated with water are things that I talk to my patients about with lifestyle.
Absolutely. Thank you, Doctor. Absolutely. I believe that we need to begin to focus on our lifestyle. Indeed, it has a lot of role to play when it comes to our overall health. So are there specific and international community outreach and education for undeserved and the minorities? I know that you have an important role to play in this regard. Can you share more light?
Yes, ma'am. So for me, I'm a minority. I'm also a minority business owner. I have a solo practice, and it's really important for me, just from a personal standpoint, to give back. I feel like paying it forward is incredibly important. I do community outreach and education for, I target minority groups. So that would be, for me, it's African American or Black Americans. I have done lectures, talks, free screening, etc. here in Houston. I also do outreach for the Hispanic community. It's kind of the same types of things, as well as the Vietnamese community here in Houston, which has a very large representation.
Absolutely, Doctor. I must confess here or attest here, you're doing a great work indeed. Kudos to you. Do you have any exciting news or perhaps any important information you think the audience can benefit from? You can share if you have them.
Specific to outreach or just in general about like my practice or vein disease?
Any that you think is going to add value to the audience in the long run.
Okay. I would just say that I've been focusing on some publications and articles, which again goes attest to the outreach. Recently, I've had some publications about recognizing the signs and symptoms of vein disease. And also, I think if I could do one thing in educating anybody on any platform, what I would say is just making sure that whatever center physician you choose to go to regarding education, make sure that you understand who would be performing the procedures, again, what their education and certification is, and then who does any follow-up visits, or are there any follow-up visits? And the reason I say this is because here at my center, I do everything. Patients, it's a very personalized relationship that I have with my patients. And that may or may not be what a patient is looking for, but ultimately asking those questions, I think, is really important, because just being informed ahead of time and then allowing them to make the decision. Does that work for them? So for instance, a physician could have a mid-level practitioner or even an assistant that does a lot of the procedure or the visits, and that may or may not work for some people. So just bringing that conversation out and allowing a patient to make an informed choice, I believe, is very important.
Absolutely, good to know. Any other information or any healthy tip you like to provide to the audience? You can share if you have. Well, that's optional. We also like to connect with you via social media handles on your website if there is any.
Okay, I can't think of anything right now, but I would appreciate anything that you can do in terms of getting the word out via socials.
All right. Can we have your social media handles also on your website if there is
Okay,
any?
yes. Okay, yes, ma'am. So my website is my last name, which is spelled Reincke, Vein. It's all one word, VEIN Center, ReinckeVeinCenter.com. Instagram is my last name, _Reincke_Vein.Center. Facebook is Reincke, my last name, Vein Center. And I also have TikTok. That is Dr. Tonie Reincke, all one word.
All right, good to know. We will add that to the show notes. As important as they have really. Thank you once
Okay.
again, Dr. Tonie Reincke, an interventional radiologist that evaluates and treats leg vein disease. Really, this has been a profound and also expository topic of discussion for the audience at large. We thank you for your time and also the valuable contribution to the topic of discussion. I wish you best of luck in all of the projects you embark upon, especially in your the important work you're doing in educating and also blessing humanity, especially the minority groups in the US. We wish you best of luck and may God continue to bless your labor and your effort indeed. Now, if you'd like to catch up with any of these episodes of the show, you can do so on any podcast distribution platforms or any podcast cross-promotion platforms online. Do have a great time as you listen to profound insight that constructive yet destructive mindship conversations that is going to pivot the positive changes and transformation you and I need. Remember, this is Live Rolling by Omobola Stephen. We offer mindshift conversations that is going to move you from where you are to where you need to be. I always need you to stay safe always. My name is Omobola Stephen. Thank you for joining me on the show, Dr. Tonie Reincke. It was a great time indeed.
Thank you for having me, ma'am. I appreciate it.
Absolutely. Sure.